Hello, everybody. This is Charles Alvarez once again, CEO of Cornerstone, with a friend of mine, Adrian Velasquez. He is with a company called FiMed, which is doing some very, very interesting things in the healthcare space. Adrian, welcome to the show.
Well, thank you. Thank you for inviting me. I really appreciate it.
It's my pleasure. So let's give our audience the opportunity to get to know you a little bit. Can you tell us a little bit about your background, what your career looked like, and how you got to FiMed, and what about the opportunity intrigued you at FiMed?
Okay, and you want me to do that in 2.5 minutes? So here we go.
Take your time as long as you need.
Well, my background, I went to school at Western Michigan University to get a degree in industrial engineering, and in my senior year, I decided to get married. And then what happened is I had my first of four children, and so did not complete that degree.
Mhm.
Um, I've really been an entrepreneur all my life and the creative aspects of it. So I was involved in development of a practice management system. It was new back in the day. And what I found in working with physician practices is that there was just a lot of interpersonal needs. There was a lot of systems that needed to be put in place. Very difficult at the time. Now, at that time, a patient load for a physician was maybe 20 patients a day. Today, it's running 50, 60, 70, 80 patients a day. So it's gotten very complex. But in the process of doing that, I had a consulting gig in Milwaukee, Wisconsin, as a medical director of a physician group. And met my business partner, Christine Kraus. She worked at the bank that we banked at, and she was very sharp from an operations side standpoint. So we decided to create a company, Five Management, and we want to bring business acumen to physician practices. The first 2 years, we literally starved because nobody knew who we were. It was beginning a new business. It was just a horrible experience. Our date nights consisted of going to high-end grocery stores that have their samples out, and
A true entrepreneur.
yeah, yeah. And so we'd go and have samples there. And we ran ads in the yellow pages at that time. And we got a phone call from a urology practice. And they said, we need some help. What do you do? And I said, well, what do you want? And she said, well, we need somebody to help us with our administrative things and so forth. I said, that's exactly what we do. So that was the start. In fact, that customer, we maintain a relationship with them over the last 30 some years, and they're responsible for getting us to move to Sedona, Arizona, where we are today.
Very
But
nice.
anyway,
Beautiful place.
we started with that, and I wanted to do outcome studies. They didn't have enough volume there, so I reached out to a pathology lab and to them to do outcome studies. In the process, I met with the national regional director of that company, and he said, "What do you do?" And I told him all the things we did. He was very excited about it. He said, "Well, I'd like you to come to Atlanta, Georgia, to meet with a bunch of urologists. We got a conference there." And I said, "Okay." So we went. We hardly had money, scraped enough money together to go. We went, saw Chris on the first day, and then I didn't see him for 3 days. And I'm going, what's happening? And so as we're getting ready to leave, I'm going, what a mistake. Oh my God, I'm so sorry. And then he yelled and he said, hey, I've got everybody waiting for you. So we went in the lobby, told him about the kinds of things that we did. Several of them said, I wish I could take you home with me now. And that was our first client that we had in New York. We grew in New York with clients doing administrative functions, billing for them. We had the largest internal medicine practice in Manhattan. He was the practice. He was the physician to the stars. So he had a special backdoor entrance
How cool.
for movie stars and for theater, for playwrights and so forth. In the front of his office, he had a huge Cheshire cat that you would walk into his office over the doorway. In the lobby area on the couch was a life-size doll of Lauren Bacall and a life-size doll of Woody Allen with his arm around her. A very interesting guy. We had special invitation to the United Nations for special events there. It was an incredible experience. So we grew on the East Coast, we grew on the West Coast. We grew to have, we had an office in Richmond, Virginia, Milwaukee, uh, Draper, Utah, and Orange, California. 147 employees. We had a large pathology lab out of New York, generating about $3 million a year in revenue. So, so background, I'm very creative. I'm innovative. Um, I look for opportunities. I try to be ahead of the curve on things. It's not like I try to, it's just like I see things that need to be done. And that's how our company has grown. We're doing things today that when we started, I would never dream of doing. So it's just kind of evolved over time. Um, so I'm on the creative, innovative side. Christine Kraus, my business partner, is operations. She's extremely effective at what she does from an operation to getting systems taken care of. My background, like I said, is very on the creative side. I do a lot of meditation. In fact, I meditate every morning before I start my day to get myself kind of mentally cleansed out to
Awesome.
prepare for the day. Those of you that are in business know that you just get beat up all day long by your customers and potential business and so on and so forth. Uh, so how we've grown over the years, we have four different divisions. One is revenue cycle management. It's full service. We do everything from credentialing, provider, everything that you can be involved in that. And we do that for all specialties throughout the United States. There is no size limitation, the and it's all done here in the United States. We don't offshore anything. The second division came about in 2010 when CMS announced to Congress that they had spent 52 billion with a billion dollars in error in the Medicare program
Wow.
through paying claims that were not valid. So that's when they created RACs, VIX, MAC, ZPICs, the OIG, CMS, Attorney General, everybody sharing data to identify, to audit claims, identify those claims that were didn't have documentation to support uh, uh, the amount of money that was paid, and they would recoup that money. So I saw that, and I've decided what we do is we created a product called Reveal. Reveal MD, and basically what Reveal does is it takes all the billing data in from a hospital system or any organization and does a statistical analysis and compares it to their peers nationally the same way CMS does. And we identify the statistical outliers, those providers that are overcoding, potentially subject to audit, those providers that were undercoding and therefore there was lost revenue. We had great success with that. We have had over 31 hospital systems using that from USC, City of Hope, Mount Sinai. Mount Sinai is still a client. Uh, University of Rochester, University of Alabama, Birmingham, and on and on and on it goes. And great results with that. The next division that we created was actually through an acquisition. We acquired a practice management system that had billing companies using that system, and we provided all the software support and maintenance of that system, and still in use today. The next division is probably, I think about 8 years ago or so, CMS announced a program for chronic care management. Chronic care management is between office visits. It's non-face-to-face. It's for Medicare patients that have two or more chronic conditions. And unfortunately, probably about 70% of Medicare patients have two or more chronic conditions. And so the kind of service that we provide, we do annual wellness visits for our providers. We have our own advocates and staff that does that. We also do chronic care management, which is dealing with patients between office visits. And the kind of things that we deal with are called social determinants of health. So it's things like they don't have transportation, or they don't have money for drugs or for prescriptions, or they haven't eaten in days, or they feel a threat to their family, or they feel like they're a bother to their patient to their family itself. So we provide that service, and it's interesting. When you read the manual on chronic care management, it looks very easy. The patient wins, the doctor wins, everybody wins, and so forth. It's very, very complicated. And it's complicated from the standpoint that the physician is so busy today, they hardly have time to really look at this. Hardly anybody's doing annual wellness visits, even though it's free to the provider or to the patient. It reimburses well to the provider, but it's too time consuming. It takes about 45 minutes.
Mhm.
The chronic care management portion of that, very few people are doing that because they don't have staff to do that. So it's been very rewarding for us, but it's different geographically. So we have clients in the Appalachian area that are very, very poor, very, very proud. If they work at McDonald's, they're not making enough money to be on Medicaid. And they also can't afford insurance.
Right.
And oftentimes when they go to the hospital to go to the doctor, it's too late.
Yeah.
And so it's just a tragic environment. So we work with them in those situations. On the East Coast, we've got practices that are half Hispanic, half English. So we have multiple types of opportunities there. So we renamed that. Instead of being chronic care management, we decided to call it our Well Living Initiative because we felt that was a more positive thing to be a part of, the Well Living Initiative as opposed to chronic care management.
Right. Chronic
Uh,
sounds so dire.
Yeah, yeah. And we've been doing that for about 8 years now. We have great success with it. It's probably our most rewarding program that we're doing. It's so beneficial. The success of it, if anybody wants to get involved in that, the success of it is emotionally connecting to the patients.
Yeah.
That's the success.
Yeah.
If you're just going to call and run numbers and ask questions, it isn't going to work and you'll fail. But it's and our advocates get so emotionally connected that unfortunately when a patient dies it's just traumatic on our side, so it's quite a deal. The other division that we did is let's see, I mentioned revenue cycle management, reveal, well living initiative, and the software. So value-based care, when that came out several years ago, we had a client that called us and said, could you help us? And I said, what do you mean? He said, well, my responsibility is to find gaps in care with these managed care programs, value-based programs. And it takes me 4 hours to identify 10 patients in Epic. Is there anything you can do? And I said, well, I don't know. What's a gap in care? And she said, well, it's the value-based care, it's the diagnosis that risks adjust that was used last year that hasn't been used this year. And it's either it's no longer a condition that exists or they just didn't put it in. So I got together our team. We developed this internally, the same team that developed our first Reveal product, and we created the Reveal Wrap application. Both of them are SaaS. So what it does is it took her 4 hours to identify 10 patients. It takes 4 clicks of the mouse to identify the gaps for the enterprise. We can do it by specialty, we can do it by provider and by patient. And we use the actual billing data that was sent to Medicare Advantage plans, not what's in the EMR, because oftentimes that's different than what was billed.
Right.
So, so those are basically the things that we've done. We've got great staff. We've got great people. We're always looking to improve things. I've been looking at AI, a little concerned about that, but some of the things we do with AI it's just mind blowing. I have no idea how it's done,
Mhm.
but we're looking at artificial intelligence for denial management and also artificial intelligence. We're looking at that for our statements, where we can actually identify the propensity to pay for a patient. So that kind of covers what we do and how we're doing it. We're um, always looking to provide assistance to the provider and the patient. We have always, for the last 32 years, we have always been physician advocates. But what's changed is we're now physician advocates and patient advocates. Because in my opinion, and my own personal opinion is, I feel that healthcare is really in crisis. Um, Physicians are burning out, staff is burning out, patients are burning out. It's a situation where when I moved to Sedona, I don't have bad health. I said, I think I need a primary care physician. So I went online. The closest I could find was a nurse practitioner in Prescott, which is an hour and 10 minutes away.
Oh my gosh.
So I called up, said, are you accepting new patients? They said, yes. And I said, great. When can I come in just to meet you and have an exam? 6 weeks from now.
And you're like, but I'm hurting now.
Yeah, yeah. So the good news is my lab work is done at LabCorp here in Sedona, which is like 5 minutes from my house. But to get the lab work read and everything else, I've got to go to Prescott, which is, like I said, an hour and 10-minute drive away. Love the nurse practitioner, but man, what a hassle. And Sedona is considered a healthcare desert just because of the lack of providers available. But the problem is that's a national situation. I don't care where you go, East Coast, West Coast, Midwest. The availability of seeing a provider today is running 5 to 6, 7, 8 weeks out.
Yeah.
And we had a situation in North Carolina where a patient had a regular provider see him all the time, hadn't seen him in 3 years, and said, "I think I'll just go for a checkup." Called up and they said, "Well, anybody that we haven't seen in 2 years is now called a new patient, and we're not accepting new patients."
Uh, yeah.
I, and so they get upset with the provider, but it's not the provider; it's all the rules and all this stuff. So
Right.
we're doing our part. One of the things that we did, and it took us 2.5 years to put this together legally and everything else, but we created a medical practice in a fitness center in North Carolina.
That's interesting.
They've got 19 locations, 15,000 active Medicare members in their Silver Sneakers program. And we just started that program about 2 weeks ago. And it's being incredibly successful. In fact, we're there's another fitness center here in the Phoenix area that reached out to us and said, we really want to do the same thing. People that I tell you, here was what was surprising to me. We asked for the demographics. So I'm thinking, when I went there, it's crazy. I went to the fitness center, and as soon as I walk in, all of a sudden I stand up straighter and suck my gut in. So, because I'm walking around looking at these 40-year-old bucks walking around, they're lifting weights, doing crazy stuff. The women are just athletically fit. I'm feeling somewhat inferior, but I walk around there. So I said, "Could you give me the demographics?" They did. I'm figuring most people like 30 to 50. They had in the 90 to 100 years old age, they had 127 people.
Wow.
That whole segment was close to about 900 people. And I'm going, this is incredible. So here you've got people that want to improve on their health through exercise and weight training and strength, which is really what you should do. And so we said, these are people that are going to be healthy. Let's work with them. And it's been great. Um, Yeah, it's just we've got providers that are struggling under all the administrative stuff. So I don't know if told you what you needed to know, but that's kind of what we're doing and where we're going. And uh,
This isn't about what we need. This is for the benefit of those listening, and I'm sure everybody of our, all 27,000 of our network works with doctors that they're having a hard time getting in and seeing, and this might be a great opportunity to say, hey, check these guys out. They know what they're doing and they can help you. So, give us more examples of some of the results you've been able to deliver to not only the physicians but also to the patients. So, can you kind of walk us through? I know you've shared quite a bit, which is great, but can you do a
sorry.
couple of others because, I mean, it sounds to me like you're really in the line of fire. I mean, you're dealing with challenges that everybody's experiencing. I mean, I get frustrated, Adrian, when I call the doctor. It's like, yeah, the doctor will see you in 4 weeks. I'm like, by then I'll probably either be dead or be good.
Yeah.
So walk us through some case studies on what the challenge was and what did you do to fix it, and what are the results that the physician and the patient gets to now experience by working with you and your team.
Okay. Well, I'll mention it on the Reveal MD side I'll mention that one first. That's the predictive analytic tool, the SaaS application that we take all the billing data. We do it every month, so you can see trend tracking over time. Are they improving? Are the providers getting better in their coding or worse, and so forth? So we had a client on the East Coast that has been using Reveal for a number of years, and they were going to be audited by Blue Cross Blue Shield. So they got a letter, and Blue Cross Blue Shield said, here's these providers that we want to look at and audit. Now, those in healthcare know that in an audit, one, it can be very expensive. An audit can go anywhere from 1 to 5 years, very expensive. And they can say, well, we reviewed these two claims. We overpaid you by $45, so send us the money. Or it could be an extrapolation. We looked at these 40 claims. You had a 20% error rate. You billed out this much over the last 3 years, so you owe us $450,000. Or it could be it's so egregious that they're under a corporate integrity agreement, which means you've got to meet these rules over the next 5 years, or you'll be excluded from Medicare, which would be the death of an organization,
Yeah.
financial. And the last is if there's something really criminal, there's jail time, fines, and everything else. So we had a large hospital system on the East Coast that got a letter from Blue Cross saying, we want to look at these providers. The compliance officer there and the medical director responded back, said, we know about these providers. We're using Reveal and analyzing them every month. We're monitoring their coding and documentation and so forth. And they gave them the statistics that we had and everything else. And what happened was Blue Cross Blue Shield said, okay, never mind. And they canceled the audit, which blew me away.
Yeah.
The We have a large health system on the West Coast. So what happens is it statistically shows you things. It's clicks of the mouse. There's not, and it's beautiful to see and so forth. Uh, but we had to have a large hospital system on the West Coast that said, instead of having our compliance officers see these numbers, and of their 2,000 providers, they have about 200 that are outliers. What we would like is that graphic to be sent directly to the provider the moment they're an outlier, and also to the person that's supervising them and advising them on coding and documentation. So what happens now is it goes directly to them, and we're also finalizing artificial intelligence that can take the charts, review the charts, and grade the charts and show where their strength, weaknesses, and where areas of improvement. It does about 500 charts an hour. So that would be one example. With our well living initiative, we've got so many. We had a situation where we reached out to a person that would live in the projects on the East Coast. No answer, days passed, no answer, days passed, no answer. And finally she answered and said, why are you calling me? And we told her that we were representing Dr. So-and-so and see how she's okay. And come to find out, she said, well, nobody calls me because I live in the projects. And she hadn't eaten in 3 days.
Oh gosh.
So we got Meals on Wheels over to her and got that taken care of. We had another situation where we also do transitional care management, which is when a patient's discharged from the hospital, we pick that patient up and they were prescribed by the hospitalist some blood thinners. We did a medical reconciliation and found that they already had the prescription for a couple of blood thinners. We contacted the doctor. He says, my God, if they take this, they're going to die. So he said, I can't call the pharmacy to cancel this. I have to call their physician, have them do that. So we went through that process and did that. So that was another example. I mean, there are just hundreds and hundreds of examples of that kind of thing. The Yeah, so it's that kind of thing. I don't know if there's anything. I've got all kinds of stories, but it's typical of a situation where we had a quadriplegic that wanted to be able to drive. So we put him in touch with an organization that outfitted his automobile so he could now drive.
That's amazing.
So it's beyond, it's kind of beyond all that typical stuff. So um, very, very rewarding.
Oh, I mean, you're changing lives for the better, well, both on the patient side and the physician side. Uh,
And also in a very, very busy, all the things we're doing today, like I said, 30 years ago, we never even thought of. But also, one of the things that's happening today in these very busy offices. So, in dealing with one of our clients and calling their Medicare patients, they would complain. They said, I don't know where my referral is. I haven't got my referral. Another one said, my prescription, I'm waiting. I've been waiting days for my prescription. I don't have it. Well, the office was so clogged up with administrative things. And also, patients would call us and be pissed off because nobody answers their phone. They don't call me back. So we implemented that in our well living initiative where we do that. Now what happens is patients will call us first to
yeah,
schedule, to follow up on their prescriptions or their referrals or schedule appointments. They've got questions. So we're actually relieving some of the workflow for a provider's office too. Um, It's almost like when it pops up, the good news and bad news about us, because it gets us in trouble sometimes, is that when an issue pops up, we'll handle it. We don't say, well, that's not what we do. We do what we have to do to to make it happen. And that's really kind of how we've grown. It's like if you or anybody's ever done any sailing, you know, when you're at point A and you want to go to point B, you can't sail in a straight line
Right.
because the wind currents, the ocean currents, or whatever, everything else. So you zigzag back and forth. It's called tacking. Well, that's what our organization does. We're moving and then we come across with an issue, we tack. We come across an issue, tack, make adjustments, solve it. Come across another issue, tack, solve it, and move forward. So we're in constant change, and that's very frustrating for my staff. You know, because why can't it be this way always?
But yeah,
Well,
yeah,
you know, and the thing of what's nice about it being this way always is it's predictable. Predictable in order of the future. You know exactly what's going to happen today at 10 o'clock, what happens tomorrow at 10, the whole week. Unfortunately, the dynamics of healthcare, this industry is such that it's changing so rapidly that it's hard to stay up.
you're right.
And I mentioned healthcare in crisis. It is. And I'm not even talking about what's happening in the administration with a big, beautiful bill. I'm saying before that. And right now I've got YMCAs that we'll be working with. They're saying we can't do anything right now because we have no idea what's going to happen with Medicaid. If we lose that, we've lost millions of dollars. We've lost patients that we can't treat. It's so I don't know. It's a big dark cloud ahead, but we'll get through it and do what we got to do.
Well, the fact that you're helping doctors and physician, or same thing, uh, relieve some of the administrative burden so they can focus on what they do well as getting the patients what they need. What's so cool about your business and why I was so excited to have you on the show is because regardless of what's happening in an administration or what's happening with public policy, the needs of your physician clients and the patients will remain the same, which is I want to
Mhm.
provide great quality care to my patients.
Yes.
I don't want to get bogged down in the administrative work. I do not have the time to keep up with all the changes in policy. But at the same time, I still want to provide great care to my patients and make sure that they get what they need. And the great thing about that is, when you and I first talked and I kind of thought more about your business, I kind of see you as the glue between
Oh.
the physician, the provider, and the patient.
Mhm.
I call it, you take care of all the things before and after the visit to make the physician's life easier, as
Yeah.
well as make
Mhm.
the patient's life easier as well. So I think you've got a great business, and thank you for yourself and Christine for starving yourself for 2 years to get to this point because and
Yeah.
I think the sustainability of your business is fantastic because we're always going to have these challenges. I don't think in my lifetime or even my great grandkids, which I don't have any yet, lifetime, I think solving the healthcare issue is going to be a big challenge. And
Mhm. Mhm.
like you mentioned in crisis, um, in terms of the top three crises that you see, Adrian, what are they, and do you see any solution to them?
Oh, well, there's so many. I think it's actually what kind of bubbles up the top of my head is administrative work. All the administrative things that a provider has to do, not only to record and document what he did with the patient, but from the legal standpoint. At USC in California, I attended a conference. This was 40 years ago. All the physicians were there, the HMOs were there, and everything else. And they were introducing a new product called RoboDoc, which was an automated hip replacement thing, you know. And it started off like the old Dragnet days with a sweaty hand and banging on the thing and so forth. But in questions and answers, one of the physicians said, I am doing so many procedures that are unnecessary. I'm doing so many things that are expensive for the patient. But if I don't do it and I get sued and I haven't done those things, I'm screwed. He said, so basically, I'm practicing medicine from a legal standpoint, not from what the patient needs. That really stayed with me. And today, what's happening is with Medicare Advantage plans where you have to have prior authorizations, they're actually they'll actually approve some treatments and not approve others. And so what happens is they're actually directing how a physician will practice medicine.
Mm,
It's just
that's not right.
it's just not right, and it's
Right.
for economic reasons.
Sure, of
Um,
course.
and
Always.
also they have some things that they won't directly say it, but they'll have some procedures where it pays higher than others, and so what physicians will jump to maybe is the higher one because they need reimbursement. So I think administration is a big problem. I think the fact that that providers are not held in high esteem as they once were.
Yeah.
I think that, in my opinion, and I probably get some people upset, but I believe that on the billing side, insurance companies are doing everything they can, including AI, doing everything they can to not pay a claim
Right. Oh, yeah.
or
Yeah.
to delay the payment of a claim. So when a claim is denied, what it means is to get it paid, our team has got to go and research why it was denied, pick up all the information, resubmit the claim, and hopefully it gets paid.
Yeah.
The time it takes to do that is a loss. It's
Right.
an economic loss to do that. And oftentimes practices and hospital systems just won't do it and
Yeah.
they'll take the loss. So I think that's another major area. Um, in the and the practices are so I've got something that was a study that was done. It said for a primary care physician to treat their patient load the way they were taught in med school, it required 27 hours in a day.
Jeez.
It's a mathematical formula. It just doesn't fit. So, um, what we're trying to do in our little world, in our little world, is do the best we can for our providers, the best we can for the patients. And like I said, it's very rewarding, but very challenging. I put myself in a position of being a physician. So here I am as a physician. I'm seeing 30, 40, 50 patients a day.
Yeah.
And that means I've got 30 or 40 patients that have different issues, different levels of fear. They're not coming into this practice happy. They're coming to the practice scared and so forth. And and so you prescribe certain things for them to do, whether it's medication or exercise or what diet or whatever. And that's behavior modification to do that, and they're not going to do it.
No. No.
And what do? You see the next patient, and you see the next patient, and then you fight with the insurance company to get paid.
It's ridiculous. Yeah.
Yeah, it is ridiculous. So again, I'm probably painting a very bleak picture, but from my perspective, that's what it is, and that's why I feel like we're committed to doing what we're doing, and really want to change the world of healthcare. And this venture into the fitness center is just it was just somebody said, "Hey, why don't you do that?" That was 2.5 years ago,
Yeah.
and I thought it'd be an easy thing, but man, to deal with all the legal issues and corporate practice of medicine, every state has different laws and rules and doing all that. And we've got a great team here. We've got incredible people that are very committed and we care a lot about each other and care we have, everybody works from home. We have no bricks and mortar.
Yeah. That's
And
great.
so
That's great.
so this Halloween we're having a Halloween party. Everybody's got to dress up in costumes and we'll be on Zoom.
That's
And then we'll also have a in the past we've had baby showers online. We had we had a what do you call it, a what do you call it where you look, oh, scavenger hunt. So everybody there's on the screen. We say, okay, we need a candle. So all of a sudden everybody disappears from the screen. Then they come back on the screen. They've got a candle, and we gave out prizes for that. So we still keep a sense of team and coordination and working together and great compassion for each other. So
well,
again, I
thank
don't know
you.
if I answer your question, but
No, no. I mean, thank you for what you do. I think a lot more physicians and patients need to know about you guys. If
oh,
somebody
thank
wanted to learn more, Adrian, what's the best way for them to do so? How can they contact you? What's the best way to do that?
probably the best way would be email. So my email is Adrian, that's Adrian at FIMED.com. So that's F as in Frank, I, M as in Mary, E, D as in David.com. And that'd be the best way. I'd give you my cell, but my God, if I don't know who you are, I get like 30 spam
Oh, I
calls
know.
an hour. So that'd be the best way. I'll tell you one other story that happened too.
Yeah.
So when we were in Milwaukee, or we started business in Milwaukee, the Latino Entrepreneurial Network, and it's a network of people started by Nelson Solar. And what he does is he works with young people and adults to help them start businesses. So each summer, he has a 2 week camp for junior high and high school students to learn about business, become an entrepreneur. So he brings in bankers, he brings in various people to show you how to do business plans and so forth. And he asked me to come in and speak to them about being an entrepreneur, which I did. So I did it 2 summers, and then I did another. He nominated for us for the Small Business Award, Persons of the Year Award for the state of Wisconsin, which we won. Went to Washington, D.C. It was a phenomenal experience. Well, I got an email from him about 3 months ago. He said, "We're having our 20th anniversary coming up, and we'd like you to be the keynote speaker." I was
Oh,
floored. I
that's
was floored.
that's cool.
So he said there'd probably be about 300 people there. So so I'm trying to work out what I'm going to say. And then I think, well, I should say it in Spanish. Well, hell, I don't know Spanish other than So with that, then I thought, well, I'll do it on my phone. I'll talk to the phone and that ain't going to work. So he said, don't worry about it. But anyway, that was just a surprise, and it's those kinds of things, though. I feel very fortunate. I'm very fortunate that I'm doing what I'm doing. I feel very fortunate that you reached out to me and gave me an
That's
opportunity
me
to
too.
talk. I feel very fortunate that Nelson Solar reached out to me and wants me to speak to his community about being an entrepreneur and the success of it. And one of the questions I was asked is, what's the greatest thing? What's your greatest accomplishment? And I was thinking and thinking and thinking, and I said, I think the greatest accomplishment is knowing when it's in an adverse situation, it's just dark and dreary and dull, and just you think it's going to not, you're not going to get out of it, that I do get out of it.
Yeah,
We had a client that we were generating $3 million a year in revenue, been a client for 8 years. They were acquired by another company, and we lost that revenue.
yeah.
And how do you replace $3 million? My whole infrastructure was set up for that. So I think what it is not that I look for adversity, but when it happens, I know that myself and our team can come together and make it happen.
Yeah.
And that's what we do in all situations. Very good problem solving. So,
That's amazing. Well, and also you have the mindset to say, instead of saying this is the worst thing ever, which I'm sure you had those thoughts too,
oh, sure.
I think you asked a very important question, which is how do we overcome this? And I think
Yeah.
that's the key for any entrepreneur because, a lot of people think that are not entrepreneurs, Adrian, and I'm sure you've come across a few, think that, wow, this guy has a $20 million business and he's got $3 million in profit. Wow, it must have been so easy. I don't know about you, but for me, and I'm sure a lot of entrepreneurs, that road to success is bloody, it's charred, it's it's scarring,
Yeah. Yeah.
and it tests you in every which way that you could not even possibly imagine. So thank you, Adrian, for what you do. Give us the website and your email address one more time before we sign off, please.
Sure. Website is www.fimed.com. F as in Frank, I, M as in Mary, E, D as in David.com. That's our website, and you'll see all of our divisions on there. Uh, the best way to reach me is, again, my email is Adrian, Adrian, at fimed.com, Fimed.com. And if you want to give it a shot, I'll give you my cell.
Uh, it's your show, my friend. If you want to give it out, great. If not, that's okay too.
I'll give it out. So leave all the dating people away from, don't send any dating apps to me. My cell is 414-975-5702. It's with me 24/7. And on this, what I don't understand, don't recognize the call, I'll put it to voicemail. So leave me a voicemail if I do that. And I may pick up too, but love to talk with you. And it doesn't have to be for business either. I mean, I'm more than happy to speak with you about whatever, like you're dealing with an issue, like some brainstorming ideas. I'm happy to do that too. So,
Adrian, thank you so much for being our guest. You were excellent. I really appreciate you. I appreciate what you guys are doing and to keep healthcare as high as it possibly can be. So thanks for all you do.
well, thank you, Charles. I really appreciate it. I appreciate the opportunity to speak with your audience, and I hope somewhere somebody found something meaningful.
I'm sure they did. Thank you so much, Adrian. Take care.
Thank you. You too. Bye now.
Bye bye.